Hi, my dear friends. Today we will talk about histrionic personality disorder. A histrionic personality disorder, it is commonly known as dramatic personality disorder. It's a psychiatric disorder distinguished by a pattern of exaggerated emotionality and attention-seeking behaviors. This personality disorder is categorized within a cluster B of personality disorder. Cluster B personality disorder includes conditions such as narcissistic personality disorder, borderline personality disorder, and antisocial personality disorders. These personality disorders are commonly described as dramatic, excitable, erratic, and volatile. The cluster B personality disorders, they are commonly described as dramatic, excitable, erratic, and volatile. Specifically, people with histrionic personality disorder are typically characterized as flirtatious, seductive, seductive, charming, manipulative, impulsive, and lively. As per DSM-5 criteria, a diagnosis of histrionic personality disorder requires a pervasive and ubiquitous pattern of consistent attention-seeking behavior and emotional dysregulation as outlined by specific manifestations according to DSM-5 criteria. Diagnosis requires meeting 5 or more of the following criteria. Number 1, uncomfortable when not the center of attention. This is the important one. If the person is not the center of attention, he will become uncomfortable. Selective or provocative behavior. He will try to seduce others and provocate others. Shifting and shallow emotions. Emotions will always shift. Uses appearance to draw attention. He uses his appearance to draw the attention of others. Impressionistic and vague speech. Dramatic or exaggerated emotions. Suggestible or easily influenceable by others. Considers relationship more intimate than they are. These patients take repression and dissociation as a significant form of defense mechanism. Now, out of these symptoms, the person should need at least 5 or more so that he can be diagnosed as histrionic personality disorder. There are 6 types of histrionic personality disorder. Number 1, appeasing histrionic. In that, the appeasing histrionic is characterized by dependent and compulsive traits. Number 2 is vivacious histrionic. Here, they are highly seductive and tend to have hypomanic energy. Third classification is tempestuous histrionic. Here, this particular subtype of histrionic personality disorder is an amalgamation of disorders, histrionic and negativistic personality. Fourth one is disingenuous histrionic. Here, the personalities tend to possess both histrionic and antisocial behavior pattern. Number 5 is theatrical histrionic. Here, these individuals tend to be highly dramatic and simulate desirable behavior and body languages. Next is infantile histrionic. Here, these individuals have a combination of histrionic and borderline personality disorder. Symptoms of histrionic personality disorder. Number 1, persistently seeking attention from others. Number 2, theatrical behavior with over-dramatized emotions. Number 3, poor tolerance of frustration. Number 4, highly sensitive to disapproval or criticism. Number 5, attracting attention through physical appearance, provocative dressing and sexuality. Number 6, rapidly changing and shallow emotions. Number 7, suggestible, overly trusting and easily swayed. Number 8, excessively focused on physical appearance. Number 9, sudden mood swings. Number 10, feeling discomfort when they fail to attract the expected attention. So these are the symptoms of histrionic personality disorder. The causes of histrionic personality disorder are genetics, parenting styles, traumatic experiences, brain structure, personal factors. Treatment for this histrionic personality disorder. Generally, individuals with histrionic personality disorder are reluctant to seek treatment and they believe that they do not need therapy. They always believe they are perfectly okay. Although more research is needed, clinicians and experts believe that a patient can successfully overcome his symptoms of HPD with psychotherapy and medications. If the patient has symptoms for other mental conditions like anxiety, depression, borderline personality disorder, or other comorbid conditions, then these disorders should also be addressed and treated as well. Treatment of histrionic personality is mainly done with the help of psychotherapy. Under the psychotherapy, we have several therapies like cognitive behavioral therapy, cognitive analytical therapy, functional analytic psychotherapy, psychodynamic psychotherapy, holistic therapies, talk therapy, behavior therapy, group therapy, family and couples therapy, supportive psychotherapy, and then psychoeducation. According to some experts, medications can also give lot of respite to some symptoms. There is no specific medication for the treatment of histrionic personality disorder, but HPD may result in affective dysregulations leading to tearfulness, anger, mood swings, depression, and anxiety in the patient. Medications may be helpful for recovery or panic disorder. Coping strategies for histrionic personality disorder are: number one, educate yourself or educate the person who has this problem. Learning and gaining knowledge and properly understanding the condition can motivate and empower the person. Second is learn stress management skills. Practice relaxation techniques like meditation and deep breathing every time you feel anxious or stressed. Number three, be physically active. Taking care of your physical health is crucial when trying to overcome any mental health problems. Number four, improve your health. Take a nutritious diet and do physical exercise every day. Number five, avoid drugs and alcohol. This drugs and alcohol is trying. If you take this drugs and alcohol, the problem will worsen than it improves. Number six is follow your treatment plan. Talk to your doctor, talk to your therapist, be with them, take the treatment with them, along with you. Everything will be clear. Thank you.